4 months after North Carolina overhauled the state's Medicaid program, some small businesses continue to ask, where's the money? Many are left waiting for tens of thousands of dollars in unpaid claims. The recent transition to Medicaid Managed Care impacted more than 1 million low-income adults, kids, pregnant women, seniors, and people with disabilities across North Carolina. Our Nate Morabito learned some of the people who care for those patients are still not getting fully paid.
Imagine putting in the work and then waiting months for a $25,000 paycheck. Some small businesses say the state of North Carolina is putting them in an impossible and preventable situation.
And they come in a variety of sizes and shapes.
Corey Peña's passion is helping children battle cerebral palsy and spina bifida.
It allows them to do this, and when they pick their foot up, it does that.
Most of the kids his Concord Orthotics business fits for braces
I love taking care of these children,
are Medicaid patients,
but it's starting to tie my hands.
which means lately
I'm like,
Peña finds himself bracing
there's no rhyme or reason.
for delayed payments. Long before North Carolina handed over control of its Medicaid program to 5 private companies, Peña says he prepared for bumps in the road.
I'm very disappointed.
But 4 months in, he says he never expected this.
I don't like thinking about it. I don't want to go there.
He's taking a hard look at the future of his business
It's been since the beginning of July,
What?
all the way back to July.
while waiting more than 4 months to get fully paid. Past due money, he says, adds up to more than $45,000.
I said, I can't be the only one going through this.
Records show the state's provider ombudsman has opened more than 400 cases a month since July, the result of calls and emails, questions and complaints. A small number, the state suggests, when you consider managed care has processed more than 10 million claims since July 1st. According to the North Carolina Department of Health and Human Services, roughly 90% of those cases are resolved. Overall, the agency has considered the transition a success.
Not acceptable. We're fixing it.
But in August, amid questions from providers and us, the Deputy Secretary for North Carolina Medicaid acknowledged room for improvement.
When you've had years to prepare for this, how do you explain that to them?
If I was the organization that wasn't getting paid, I would feel exactly as they did.
Since then, speech therapists who previously waited to get paid told us their payments are now consistent. But all is not equal. 2 mental health providers in different parts of the state told us they're still waiting. One out more than $50,000 in unpaid claims. A spokesperson said the state is committed to ensuring providers continue to get paid and is well positioned to continue to support those in the minority who are experiencing issues.
Now we're in November, and virtually almost nothing has changed for us.
Corey Peña says he and his staff have met with managed care representatives to fully understand the changes.
Just hang on. Just hang on another month. It's been since the beginning of July.
Yet here he still waits for full payment. We've shared Corey Peña's information with the North Carolina Association of Health Plans, hoping the organization can help him collect his payments. Nate Morabito, WCNC Charlotte.
If you're asking where's the money, we're here for you. Just go to WCNC.com/money and you'll find links to our stories and helpful resources.